Hi Sleevers, my name is Vita and I just wanted to talk to you about my experience and to also let you into my journey. I have just had the gastric sleeve about 13 days ago, so I'm 13 days post-op, and I just wanted to document this so that I can help somebody else maybe going through it or considering it or going through just the first week. I'm glad for my support that I have, because without them, this has not been really easy. Today I'm feeling well, I'm feeling good, and I'm up and everything, but there's just some things that as I was watching other other YouTube subscribers that they didn't mention was some of the things that we go through. Some I did hear, some I did not hear. So just in case you're going through the same thing, because this is like pregnancy. I'm 43 years old, so it's like pregnancy. Every last one is different, but then some of them are similar. So maybe you're going through the same thing and this can help you. I hope so. But let me show you a picture. This was probably Memorial's Day, because today is June the 18th. And so that was just a couple of weeks ago. I just want to show you what I look like. That's me in the leopard print. And this is me just a couple of weeks later. I'm nowhere near any goal weight, but as you can see, my face is not so round and starting to lose weight. My starting weight was 214, and today I am 13 days after. I am 191. I am 4'11", so 214 on a height of 4'11" equals all of this wonderfulness that needs to go. But some of the things, I just want to throw this out here. I am no medical professional. I'm not giving any advice. I'm just talking about my experience. So the first thing is that I did not believe them when they said in a hospital that this is what you will be eating and that you would be full off of this. It is true. There has been days when I could not finish what was in this, but I knew I had to get in the proper amount of liquids and things like that. And one of the reasons why is that I probably went to the bathroom before my surgery probably about easily 6 times, if not more. I've only been going to the bathroom to do a pee maybe twice a day, and that's it. Because what goes in comes out. Not much is going in, not much is coming out. So get used to that, and this is true. They tell you they want you to increase. Right now I'm on what's called a full liquid diet. When I was in a hospital, I was on a I guess just a liquid diet, whereas though I was able to do broth, juice, water, and jello, I believe. But in a hospital, it was hard to just, sip. They just want you constantly sipping on something like this. And it sounds easy, like shot back. Anybody do jello shots in their time? Just shoot it back. Nope, you're sipping, and it's taking you almost 10 minutes, 15 minutes to sip just this. And you don't want to, your stomach doesn't want to. But my experience was a one-day stay. Everybody's different. I have a girlfriend who stayed 3 days, who's had it done. I've had people who stayed longer, people who stayed 1 day. Mine was just 1 day. I was in and out in 1 day. And when I first went, I had to be there at 5:30 in the morning. I had to fast the night before. First, prior to that, I was on a 1,000-calorie diet for 2 weeks before that. Some people are on a full liquid diet 2 weeks. It just depends on what your doctor does. My doctor didn't require it, so I wasn't on it. I was on 1,000 calories. And if you're on 1,000 calories, one of the great apps that you can get that will help you is called MyFitnessPal. So try that. That's a really good one, MyFitnessPal. And I used that. I didn't count the exercise or the walking that I did, because it allows you to intake more calories, and you want to shrink your liver, because that's really important, because your liver is in the way of your stomach. So you want to make sure that they have complete access to your stomach. I also had to have my gallbladder removed, as some of you might have had to have that done or heard about this. I had gallstones in my gallbladder originally to the procedure. So instead of coming back a little bit later and having to have it removed, I was able to get both removed at the same time. You can Google about the gallstones in the gallbladder if you want to. I'm no medical person, so I'm not going to go into it. Just I had them both done at the same time. And so my first day I had to go to admissions, 5:30 in the morning. After admissions, they took me upstairs to the pre-op area. I got undressed, got on a gurney. There I waited with probably about 25 to 30 other people with a curtain just separating us in the room as we waited for our surgery. Mine was scheduled at 7:30. I was fortunate enough that my surgeon for that day, which was June the 6th, 2016, only had one other case. So basically they was trying to get me in and out on time. I stayed there. They gave me I talked to everybody, signed all kinds of papers and consent. They gave me an IV. I talked to the anesthesiologist. After, when they was ready for me to come in, I had a team of like 3 people who wheeled me in. When I got there was 3 other people waiting there. I thought that, it looked nothing like TV OR, but it was okay. It's pretty cool. I said to the person I thought I was supposed to get, because some people will get this like sedative before. So I heard to kind of like relax you. I didn't get it. So I said, wasn't I supposed to get the sedative? They said, we're going to give it to you right now. Seriously. Right after when they gave it to, said they were going to give it to me now. The next time that I woke up, I was in the recovery room, half, out of it. So my whole surgery went. My husband said that it was 35 minutes after when they had left me. The surgeon was calling and saying that everything went well. I was in recovery. I can't remember that step. I do remember waking up and I had to go to the bathroom while I was still in the post-op area. And I had to go on the bedpan. But I had to go. I mean, I had to go. They didn't give me a catheter or anything like that, so I had to go. They wheeled me up to my room. I had like a private room, so my husband was able to stay with me. And I just remember saying I'm in pain. I was in a lot of pain, I believe, at that time. They gave me wonderful medication because I kept coming in and out. I'm assuming it was the morphine. But then I woke up about maybe 3 or 4 hours after my surgery, and I had to go to the bathroom. So I asked the nurse, can I get up to go to the bathroom? She said, well, if you feel up to it, yeah, you can get up and go to the bathroom. So I got up and went to the bathroom. And I remember watching My 600-Pound Life. And I remember some of the side effects and things that people went through. I did not want a blood clot. I did not want one of those IV filters or any complications. So when I got up to go to the bathroom, I would go and walk. At first it was just a little distance, but about the 3rd time I got up to go to the bathroom, I was walking around the whole area where the nurses and stuff was. To me, it wasn't really that bad. I didn't really have a bad experience. I did, however, those little sticks that they stick in the ice to give you, because the first night they wouldn't give me anything to drink, not even ice cubes. They didn't want me to. And so they would let me just put that on my tongue. I started getting nauseous with that, and I was wondering, like, it was the taste for me. It bothered me. So I started, like, I guess it was a vomit, but it was a dry heave, and a little bit of blood came out with it. But they said that was normal because it was just stuff sitting on my stomach. And once that happened and that passed, I was just able to, the nurse allowed me to swish the water around my mouth and then just spit it out. I was fine. I mean, I had no more problems. I was fine.